Hi, my name is Joe. My journey started about 3 years ago. I was in the gym, I injured myself doing bent over rows. I felt something go in my lower back. I went to go and see a doctor and he prescribed me some pain medication and most of the pain went away. But I sort of stuck with it for a couple of years. The pain started to get progressively worse, so I decided to go and see someone. I was quite keen at looking into regenerative medicines. I went through the regenerative clinic and found Professor Ranganathan, who then sent me for an MRI. And these are the results that we had. So you can see here that we found that I had a degenerate disc, which we thought may be causing the pain. However, didn't really justify the amount of pain I was in. And Professor Ranganathan also spotted that there was a possibility of a fracture. So then sent me for a CT scan. And you can see here there is a continuous sort of line down the back here. However, there is a clean break, and that's where we found out I had bilateral pars defects. And also the degenerate disc is at the level above of the fracture, which led to a few concerns, because it would mean me having both levels fused, and this was recommended by some other spinal fusions and some other spinal surgeons at an MDT. However, this would leave me sort of very stiff in my lower back and not being able to bend over and have little mobility, and this is something that I wanted to avoid. So Professor Ranganathan had the idea of just repairing that level without taking out the disc or having the level fused. So I went for surgery in November. This was the result of the first surgery. So unfortunately, we were unable to get a screw in at this level due to it being very weak, and it ended up breaking. So we had to put the screw in the level above and then feed the rod through this hook at the bottom. When I woke up from the surgery, my back pain was gone. However, I now had pretty severe leg pain down my right side. We found this was due to a bone spike that you can see here, and this was pressing on my sciatic nerve. I was experiencing pain that went sort of all the way down to my foot. The screws were in the correct position. There was nothing wrong with the screw placement. It was just that spike that was causing me issues. So I then had to go back into theatre. Yeah, so after my second operation, Professor Ranganathan was able to get a screw in at the broken level through another pathway. You can see there as well, which ended up fixing the problem for the screw placement, and also was able to shave the spike off through a microscope. I woke up from the operation, and within minutes I was standing up, walking around, zero pain in my legs, zero pain in my back. And yeah, I'm very happy with the outcome, and I would encourage anyone who's thinking about surgery or has been through a similar situation to make sure that you sort of do the research and understand what's going on. It definitely helped me with understanding the situation, and also sort of suppressed the nerves going into the operation to the point where I wasn't nervous to have it done. And yeah, the outcome is great, and I recommend Professor Ranganathan to anyone who's been thinking about surgery or has been experiencing back issues. Thank you.